Welcome to Stethoscopes and Student Standpoints, the official podcast of the Alberta Medical Association, AMA, Medical Students Advocacy Committee, and the first ever inter-school podcast led by medical students in Alberta. My name is Sana.
And I'm Abdullahi.
So let's get into today's episode. What are we talking about today, Abdullahi?
We are talking about the reality of the acute care crisis.
Yeah, let's get into it. So Alberta right now is facing an acute care bottleneck. ER wait times have skyrocketed. They've never been short, really, here. But things seem to be getting worse in that people are waiting hours, sometimes days before being admitted. And some hospitals are actually over capacity and they're operating at over 100% capacity.
Yeah. And it's not just about the beds, right? There sometimes aren't enough staff to care for these patients, right? Nurses and physicians are burning out and some are leaving the profession entirely. And this has sort of been the case with the COVID-19 pandemic. A lot of physicians and nurses faced burnout and left the profession entirely. And last year alone, Alberta has lost hundreds of nurses and physician retention remains a challenge.
Yeah, that's actually really interesting. This is one of the summer projects I had worked on. I had helped get research and looked at data on Connect Care, which is basically the electronic medical record system that we use here in at U of A and in Alberta. But essentially, we were looking at the Stollery University of Alberta here, which is the children's hospital. We were looking at the capacity over the years and seeing how COVID changed that, how it was before and after. And something I learned is, perhaps this is naive of me, but when I was pre-med, when I thought beds, I really just thought, okay, well, you don't have enough space, make more room or buy more beds. But when we say beds,
build a new ward.
Yeah, exactly. It's simple, guys. But once you get into it, and maybe that's just me, you see the intricacies of it. It's not, when we say beds, we don't mean it's just the beds that are missing or it's just the equipment necessarily. It's really that staff there and the supporting staff that are there beyond the physicians to help out, because patient care isn't just a physician. There's so many people involved there. And it's not just an inconvenience to have these long ER times that certainly I'm sure listeners have at least heard of affecting either themselves or someone else. It's a patient safety issue. Delayed care leads to worsening health outcomes, preventable complications, and sometimes even avoidable deaths.
Yeah. And as medical students, we're already feeling the effects. Fewer staff means less mentorship opportunities, more rushed training environments, and a higher emotional burden when we witness patients struggling to access care. And a lot of the times whenever I'm like shadowing, I sometimes feel like a burden or like an inconvenience with the physician I'm working with just because they're so busy, they're swamped, right? And I'm kind of just there like asking them dumb questions or like annoying them and stuff. And I'm like, man, I'm almost like a liability here. Like,
I'm sure they appreciate they've been in that position. A lot of physicians are very, very nice about that for sure, because it is a stressful career. But as medical students, I was on the EMA board last year as a part of my student governance position, and we did a survey for what do students currently think about the acute care crisis. And one of the number one questions we got from the students and their fears was surrounding what does the balance look like for the future, especially during COVID times. We saw it was pretty bad for the physicians. So with these wait times and the burdened acute care system, what's being done? A lot of people, we know the issues, we know what's being done wrong, but so what? How can we improve that? How can we change it?
Right. And as medical students, I guess, so far out from this and, just at the start of our careers and our journeys, like, what can we really do, right? And so I think the biggest thing to understand is that we are not powerless in this situation, and that the acute care crisis isn't just a staffing issue, but rather a policy issue and a funding issue and a systemic issue. And those are things that can change with advocacy, with having our voices heard and having the individuals in the positions to make these policy and funding changes set things in motion.
Yeah, we don't want to say this is the fault of government at all because I can only imagine being government.
Yeah.
Every system wants money from you and every system matters. There's teachers here asking for the underfunded education system. There's physicians asking for the healthcare system. It's just, there's only so much resources and you have to figure out how to split that. So we're not at all trying to villainize them. I really, really don't want to be in their position, to be honest. But we are, as medical students at least, responsible for getting our voices out there and really show the realities of this situation so they understand and have an understanding of how important it is. And we got to follow suite of other provinces. We see BC and Ontario, where when medical professionals and even students speak up, governments have responded and they've recognized that they need to increase hospital funding and they need to improve residency supports and adjust ER capacity strategies. And we're slowly getting better. But what are some tangible ways that we as students can advocate?
Yeah, so I think one big thing, and I think this is something the AMA students committee already does, but it's speaking up to the governing bodies, to the medical organizations, right? They're almost like that liaison, right, between us as students and the policymakers, right? And so I think one of the most effective ways is through the AMA and letting them hear our voice as the next generation of physicians.
Okay, but what does that really mean? How do we get involved? So you can certainly get your voice out there by talking to news outlets, by introducing yourself, talking about the issues and the things that you firsthand see if you are involved in healthcare, whether that's as a medical student, a nursing student, a nurse, or really anyone in healthcare or someone affected by it. Talking to the news even as a patient and getting your story out there and talking about the issues really highlights how important it is. It's really about the magnitude of our voice and how many people are speaking up on a healthcare system that needs more support, needs more funding for the acute care system. So that's one way you can do it. And something that the AMA Medical Students Advocacy Committee has been really starting to do. And that's why we published our website, the AMA Medical Students website, in that we have all of these medical students publishing their stories about all the things that they care about, things that I've never even considered. One article that was submitted that I recently was reading was about women's health. We had a whole month dedicated to women's health when here at U of A we were in our reproduction block and learning about the reproductive system. Someone did a really beautiful piece on codes, how physicians bill and how that can differ between different specialties and how equivalent procedures in men and women are billed, and how we can look at that and really addressing the systemic sexism issue that may be underlying, whether that's there or not. So it was really interesting having my eyes open to that, to a topic I didn't even consider.
Yeah.
Yeah.
And I guess another way we can, or tangible way us as medical students can advocate is through engaging with policymakers. I think this is a key avenue where having not even necessarily conversations, but just emailing your MLA and sharing your experience as a medical student, I feel like can be really inspiring. Because at the end of the day, I think perspectives need to be heard. And if we can give the individuals at the decision-making table real stories to understand how healthcare policies impact the front line, I think they can make more informed decisions on the policies affecting healthcare workers.
Yeah, that's perfect, and actually kind of brings up an initiative I was a part of last year, the Provincial Day of Action. It was a day where we actually emailed our MLAs, just simply asked for them to come talk to us, and all the medical students went on one day. This was organized by another medical student a year above us here, and it's being done again this year. Last year's was about the primary care crisis, so we went to these MLAs firsthand of all the different parties and the party in charge, and we talked to everybody there and gave our take. Yeah, we are medical students. We don't want to claim here we have any more information than physicians, for sure.
Yeah.
They know best in terms of actually being in it, and we're not here trying to pretend we're physicians. However, we shadow these physicians. We see our future, and we see the things that are changing, and it is an opinion that we do need to share, regardless.
Yeah. And a lot of medical students who are in clerkship, they themselves are in the front lines. Like they are working, for free, right, in the hospital, like sometimes, 25 hours on call, 26 hours on call. Mm-hmm. And so, a lot of the clerks have experience with this. They've seen it firsthand. Front lines is their everyday reality.
And in fact, that's really important because we have our residency match at the end of 4th year. So essentially, if you don't know how medical school works, is we have our 4 years, and at the very end, we can match into a specialty. We can match into family medicine. We can match into surgical specialties, all sorts of things. So depending on how the healthcare system goes and policies and how informed students are actually about the state of the field that they're going into, they might choose one field over another. That's why the primary care crisis was very important to us, because we saw that, okay, what are medical students seeing of primary care right now? What they were seeing wasn't fantastic. So we wanted to improve it so that when we're ready to match in 3 years for Abdullahi and I, that the state of primary care is in a better place. Yeah. 3 years. 2 years?
Yeah.
2.5. Time flies. That's wow.
Insane. And it's also a big part of it too is like, let's say you're really passionate about a certain specialty, but then you see it through shadowing, you see it through, conversations with your mentors and physicians, or even just on the news. And you see that, again, like it's sort of in a state of crisis, and there's a lot of these challenges and these difficulties, and the work-life balance doesn't look too great. And this is like, especially like primary care, for instance, that's like critical for like all of society, right?
Yeah, that preventative care aspect.
If I see that, if I'm really passionate about it to begin with, but then I see that, okay, this does not look like a good career given like the current state of things, right? Why would I, as a student, want to apply to this specialty? Why would I want to go for that, right? And then we're sort of seeing this reflected in a lot of family medicine seats going unmatched, right? Or just students not applying for it anymore. And that is rather concerning too, because again, it's like a critical piece of our society, right?
And that contributes to acute care having these huge lineups, because you don't get that care in family medicine. People don't have family doctors. Where are they going to go? They have nowhere to go, especially after hours. They're going to go to the emerge. It's not the patient's fault of clogging up the emerge. Absolutely not. That's not what we're saying. We're just saying we need to fix it step by step and look at every component.
And it's a scary thing that a lot of the times when individuals find out they have a certain disease or a certain condition, it's not like, well, this thing is in its early stages through their, routine checkups and stuff with their family doctor, but rather after having like a flare up or after having like an episode of something, and they find out for the first time in the emerge, which can be a really scary experience.
And I'm sure it's not pleasant for the healthcare workers either, and it's quite a stressful environment, and there are obviously people with empathy, and seeing that state is pretty hard and contributes to burnout. That's not fun. But let's not forget about the patients. It always goes back to the patients, of course. Even when we're talking about healthcare workers, we're talking about how healthcare workers can optimize it for the patients, because a lot of people don't realize that wait times and ER closures aren't just random. They're policy failures. So we need to educate the public.
Yeah, awareness, I think, is a key component to this. And another piece of this is that when individuals have this sense of awareness and they're informed, right, it really gets them to start advocating for themselves as well, right? And that's the sort of shared decision making we want to see, right? That collaboration and involvement with patients and physicians, because at the end of the day, I think everyone is on the same team. And so working together towards that shared goal, I think, is has a lot of value.
For sure. So that takes us to our calls to action. What is the bottom line? Well, the acute care crisis isn't just about beds and staffing. It's about advocacy, and medical students have an important role to play.
Absolutely. Whether it's getting involved with medical associations, speaking up in policy spaces, or using your voice on like social media, right? We can make an impact.
For sure. And if you're listening and want to get involved, start small. Talk to your peers, attend an AMA advocacy town hall, write an email to your MLA. And all of these are small actions. They're just emails. But over time, if enough people do that, that can lead to real change. Yeah.
And all our future patients, right? One day, they're counting on us to fight for a better system and to fight for their care.
Yeah, and if you're a medical student listening, feel free to go on amamedicalstudents.ca if you're not already listening on that site to publish your opinion piece and give us your take of this or reply to this episode. We would love to hear what you had to say, and hopefully you got something from this episode. And that's it for Stethoscopes and Student Standpoints for today, the official podcast of the AMA Medical Student Advocacy Committee. If you found this insightful, make sure to subscribe and follow us.
Thanks for listening.
Bye.